say aye. Aye. Those opposed, nay. Ayes appear to have it. Ayes do have it. Minutes adopted. First on the agenda is House Bill 2612. Any interest in the bill?
Mr. Chairman, I move HB 2612.
Council explain the bill.
Thank you, Mr. Chairman. House Bill 2612, proposing rules related to the completion of updating of source water protection plans. There's a committee substitute at the desk.
Vice Chair moves the committee substitute.
Thank you, Mr. Chairman. The committee substitute permits the department to stagger by 5 hydrologic regions when it receives source water protection plans. Source water protection plans are required to be submitted every 3 years. The department received 125 source water protection plans at one time. This does not give the department enough time to review the plans, suggest changes, and then review and update the plans, all while planning and conducting the statutorily required hearings. This change will provide a more efficient processing of source water protection plans. Thank you, Mr. Chairman.
Questions of council on the committee sub? David Pushkin.
Thank you, Mr. Chairman. Charlie, what are the differences between the introduced and the committee sub?
Delegate, the main change is the language is broken down by hydrologic regions. So there are 5 of those already defined in the legislative rule. This will give the department an ability to break it down by those 5 regions. That's the major change.
Okay, thank you.
Any other questions of council? Delegate Thompson.
Can you just explain to me what a hydrologic region is?
Thank you, Mr. Chairman. Council, can you just explain to me, you just mentioned hydrologic region. Can you just explain to me what that is?
It is an ordered grouping of watersheds.
Oh, okay. Thank you.
Any other questions of council? None? Any amendments? No amendments? Chair recognizes the Vice Chair.
Thank you, Mr. Chairman. I move that HB 2612 be reported to the floor with a recommendation that it... Committee sub for HB 2612 be reported to the floor with a recommendation that it do pass.
Vice Chair moves that the committee sub for House Bill 2612 be reported to the floor with recommendation to pass. Is there any discussion?
Mr. Chairman, could we briefly return back to question of council? I have a very little question.
Go ahead.
Council, I'm just wondering about the language that is struck in 118 to 21. What's the effect of that change? Are they still required to update their source water protection plans?
They are. They're required to do it every 3 years.
Okay. And was that just extra language there?
That's correct.
Pardon me?
Yes, it was an additional subsection that was no longer required because it's after the effective date.
Oh, okay. All right. Thank you. Thank you for clarifying. Thank you, Mr. Chairman.
Delegate Pushkin.
Thank you, Mr. Chairman. Thanks, Charlie. So they're required to update the plan every 3 years. Is that what you said?
That is correct.
And this bill doesn't change that. That's what it already was.
So it's currently 3 years. What this bill will do, it will allow them to extend certain dates. So yes, at the discretion of the department, as described by the legislative rule, they will extend beyond 3 years in order to get a stagger effect. But once that stagger is in effect, it reverts back to the 3-year reporting cycle.
I got you. All right, thank you.
Any further questions? All right, now any amendments? Yeah. Delegate Hill will move committee sub 2612 to be reported for recommendation to pass. Any discussion? No discussion. Before us is Delegate Hill's motion. All in favor, say aye. Aye. Those opposed, nay. Ayes appear to have it. Motion adopted. Next on the agenda is House Bill 2651. Any interest in the bill?
Mr. Chairman, I move HB 2651.
Council explain the bill.
Thank you, Mr. Chairman. Ladies and gentlemen, this bill has two components. It requires a pharmacist or farm tech to tell a customer when a lower-priced drug is available. This provision was added last year, and it was permissive. This year, it is changed to make it mandatory to make a customer aware of a lower-priced option. Secondly, it requires that a PBM that contracts with PEIA to provide quarterly reports to the governor and the legislature. A pharmacy benefit manager is a company that administers or handles the drug benefit program for your employer or health plan. PBMs process and pay prescription drug claims and are responsible for creating and updating PEIA's drug formulary. The following information shall be reported: the amount paid to the pharmacy provider per claim, including the cost of the drug reimbursement, dispensing fees, co-payments, the amount charged to the plan sponsor for each claim. If there is a difference between these amounts, the PBM shall report an itemized detail of all administrative fees, rebates, or processing charges associated with the claim. PEIA is required to compile the data and protect and not disclose proprietary information contained in the data. This will allow the legislature and the governor to know how much the PBM is making off rebates and the spread. Spread is the difference in the manufacturer's selling price versus what the pharmacist paid for the purchase of the drug product. This reporting will start on December 1st, 2018. If the information is not provided, the bill requires the PEIA terminate the contract. The language is based upon a language recently adopted in Virginia. Also, Ohio has recently required its managed care companies to use a transparent pricing model by January 1st, 2019. Thank you, Mr. Chairman.
You said 2018.
Sorry, the reporting will start on December 1st, 2019.
Questions of council? No questions? Any amendments? All right. Delegate Hill?
Thank you, Mr. Chairman. I move that HB 2651 be reported to the floor with a recommendation that it do pass, but that it first be referred to the Committee on Finance.
Delegate Hill moves that House Bill 2651 be reported to the floor. Recommendation do pass, but it first be referred to the Committee on Finance. Is there any discussion? No discussion. Before us is Delegate Hill's motion. All in favor, say aye. Aye. Those opposed, nay. Ayes appear to have it. Ayes do have it. Motion adopted. We're going to move down to House Bill 2607. Is there any interest in the bill?
Mr. Chairman, I move HB 2607.
Council explain the bill.
Thank you, Mr. Chairman. House Bill 2607 relating to the licensure of nursing homes. There is a committee substitute at the desk.
The Vice Chair moves the committee sub. House Bill 2607. Council explain the committee sub.
Thank you, Mr. Chairman. The committee substitute updates the article regulating nursing homes. This bill differentiates between the director of OFLAC and the secretary of the department. The previous language defined the director as the secretary, which made the article rather confusing. Person is placed in alphabetical order within the definition section. Surveyors are renamed inspectors. Provisions are removed which required compliance with reporting to the healthcare authority. However, since the nursing home facilities were exempted from those provisions in 2017, those provisions are no longer applicable. The change from the original bill to the COM sub is minor. It is on the page, which discusses how OFLAC will adjust its rules. If there is an issue that is already discussed in the federal regulation and the entity is currently certified by Medicare and Medicaid, then they should be exempt from certain federal rules. This practice is currently mandated under the rulemaking statute, so this is more of a clarification. Thank you, Mr. Chairman.
Questions of council? Delegate Fleischauer?
Thank you, Mr. Chairman.
One of you move her, or how about move Charlie's over? Here. Charlie, you can have this.
Thank you, Mr. Chairman. I have a question to council.
On page 9, the stricken language, you said that it was taken out because the health care, the nursing homes were exempted from the Health Care Cost Review Commission.
That's correct.
And I understand that number 3 would that would apply, but I'm just wondering, since we expend so much money in nursing homes, both state and federal money, why we wouldn't want financial information about them on a yearly basis.
Delegate, I'm not sure the answer to that question. I'm sorry.
Okay, maybe, Mr. Chairman, I can hear from somebody from OFLAC or the Secretary's office. Maybe it's comes to them in another form.
Any other questions at the moment? Council? All right, by legal committee, is someone here from OFLAC or DHR might be able to respond to the delegate's question? If you would state your name, title, please.
My name is Jo Lynn Moore, and I'm the director of OFLAC.
Okay, Ms. Moran. We haven't had you sworn in yet, so I'll have to do that. If you'd raise your right hand, repeat after me. I swear to tell the truth, whole truth, nothing but the truth, so help you God.
I do.
You can consider yourself sworn in for the rest of the session.
Okay.
Did you hear the delegate's question?
The question was about reporting for financial.
Yeah, it's on page 9, and it's in lines 85 through 89, and I understand why the following 3 lines. Do you have a copy of the bill?
I do, yes.
Okay. Well, I was just wondering, I was thinking that it might be helpful for the state to, if somebody is aware of their financial condition, since we spend so much, since it's a huge part of our state budget, what we it's a huge part of Medicaid, and it's a huge part. Is there any place else where we get financial information about nursing homes and if they're in good financial position?
I can't speak to the exact details of that. OFLAC only deals with the health and safety issues. So even when we go into facilities, we don't actually look at their financial aspect or their pay source or their bills and such. However, those facilities that are Medicaid certified have certain reporting requirements that I'm not familiar with, but to Medicaid and to our state state DHHR office, that they have to make certain reporting requirements too. So there is some financial information available, but I can't speak to the level of that it is or what exactly is reported by those nursing homes.
Okay, thank you, Ms. Mara. Mr. Chairman, is there anybody here that can answer the question or maybe get back to us later with the answer?
Well, that was what we were just trying to see. Is there anyone here that in the audience that might be able to answer this question related?
I can answer it the best I can.
And Delegate, we're also trying to reach DHHR, see if they can send someone over. Megan?
Megan Oskovinsky, I'm the Director of Government Relations for the West Virginia Healthcare Association. We represent long-term care facilities.
All right, Megan, if you would respond to that for me. Swear to tell the truth, whole truth, nothing but the truth, so help you God?
I do.
All right, consider yourself sworn in.
I'm going to get to the exact place, Delegate. I think I have it in front of me. I want to make sure I'm looking at the right language. So I believe the language that you're referring to that is stricken relates to financial information that we were required to file with the Healthcare Authority previously under CON. But I think it was with the 2015 or 16 rewrite of CON, a lot of facilities were no longer required to provide that financial information.
I get that.
And I think this is what that's referring to.
But my question was, is there reporting, I'm guessing there is reporting of financial information somewhere else, and I just wanted to ascertain that.
In its entirety, I'm not sure. Absolutely, Jolynn is absolutely right. We do have to report to Medicare and Medicaid and do all those. We have very significant reporting requirements for that. But as far as an entire breakdown of all our reporting requirements, I'm not
I
familiar with
understand.
anything.
Okay, thank you. Mr. Chairman, maybe you could have somebody from DHHR get back, and I'm not sure if anybody cares about it but me, but get back to us
We
with
could,
what
we could have them respond.
Yes.
That'd be fine.
Thank you. It isn't necessary to happen today. Thank you.
All right. Delegate Bates, did you have a question of the witness or of counsel? Your choice. Ms. Roskovinsky or...
Thought I was off the hook.
No, not yet, I'm sorry. I was just hoping that, thank you, Mr. Chairman, I was just hoping you could, I'm looking at the section that's on page 22 that talks about the administrative appeals for civil assessments, licensure, denial, limitation, suspension, revocation, and there's language change there. Are we denying, limiting, suspending, or revoking the licenses of nursing homes on a consistent, regular basis? Is there an issue that we're... Is there an existing process, I assume, for the city code?
There is an existing process,
And
yes,
is that-
for all of it. And my understanding of this section, it's kind of more of a reorganization of things that are already in code. I think, again, Jolynn's probably better to answer that. But yes, all of these processes are currently in code. I'm happy to say no, it's not something that we have to go through often.
So I've not been aware of it being a problem.
Yes.
I suppose that there's not been situations where nursing homes having their licenses suspended or closing nursing homes because of problems or...
Not since I've been around. I haven't heard
So
of it
this-
happening. Jolynn might be able to answer more specifically, but it's my understanding it's not utilized all that often.
Okay, and this is sort of cleaning up a little bit, simplifying that process a little bit.
Yes.
Okay. Thank you, Mr. Speaker. Thank you, Mr. Chairman.
Any further questions of Ms. Roskovinsky? Thank you, Megan. Any further questions of counsel? Do you have a response from DHHR yet? Nothing? Okay.
It's not necessary for
Okay,
me.
yeah, they're somewhere else at the moment. so-
It's not necessary.
Okay. All right, no further questions of council? Any questions, any amendments? No amendments? Chair recognizes Vice Chair.
Thank you, Mr. Chairman. I move the committee substitute for HB 2607 be reported to the floor with a recommendation that it do pass.
Delegate Hill moves that House Bill 2607 be reported to the floor, or committee sub for House Bill 2607 be reported to the floor with recommendation that do pass. Is there any discussion? None? For us is Delegate Hill's motion. All those in favor say aye. Those opposed, nay. Ayes appear to have it. Motion adopted. Next on the agenda is House Bill 2674. Any interest in the bill?
Mr. Chairman, I move HB 2674.
Council explain the bill.
Thank you, Mr. Chairman. This bill requires the HEPC to create a student loan repayment program for mental health providers. This program will require the mental health provider to live in and work in an underserved area for 5 years. The specifics of the program will be decided by legislative rule. A mental health provider includes a psychologist, clinical social worker, licensed professional counselor, licensed marriage and family therapist, or licensed clinical alcohol and drug abuse counselor. Shortage areas are designated by the Health Resources and Service Administration. According to its last quarterly report, West Virginia needs at least 129 healthcare professionals, mental health providers to remove the underserved area designation. Thank you, Mr. Chairman.
Questions of council? Delegate Atkinson.
Council, do we have any other further bills or anything else in place that's similar to this?
Not similar to this, Delegate. No. Not off the top of my head.
Thank you.
All right.
Not for mental health professionals. There is, earlier in the bill, there's discussion for healthcare providers providing primary care services, but this is specific to mental health providers.
Okay. Questions of council? Delegate Thompson?
Thank you, Mr. Chairman. Council, would this not require a fiscal note, though?
Currently, no. The reason being that the program would have to be funded after the fact. There's no giving of money right now. It would happen 5 years down the road after the person completes the requirements of the bill.
Thank you, Council.
Delegate Fleischauer?
Thank you, Mr. Chairman. Council, I wondered about a couple of things. We currently have this student loan repayment program under HRSA,
Yes.
and do we put any state funds into that?
I don't know the answer to that question.
Okay, well, I can ask that if
Yep.
if that's appropriate, but I was just wondering, will,
I know that's federal.
and I like the idea of this bill, but I'm just wondering, is the effect of this bill mean that these mental health scholarships will come out of a pot of money that would have gone to people in the health sciences program?
No, Delegate. Because it's separated out by subsections, that's not my reading of it. I read it as two separate programs.
So where is the money coming for the mental health?
That's going to have to be provided by statute. It'll have to be provided in the budget.
Oh, so this would be a brand-new, and would the mental health providers not be eligible for the HRSA grant money that's mentioned on page 1?
I don't believe they are, because the HRSA money is only for... Some of them would. The clinical psychologist would, and the independent clinical social worker would be as well. It also gives the vice chancellor the ability to expound upon that, and I don't have the program criteria in front of me, so I apologize.
Okay, so you're looking at the language on 33 to 37 on page 2?
That's correct.
So currently, we include doctoral clinical psychologists, licensed independent social worker, or other disciplines identified as shortage fields by the Vice Chancellor for Health Sciences.
Correct.
So they're already eligible for this grant money that's in B.
Correct.
And then, does D, which talks about the program awards, does that modify?
D modifies B, yeah, yes.
Okay,
that
B
is
modifies B.
correct.
And then F is entirely new. Do we have repayment provisions
It would all,
for?
I'm sorry.
Go ahead.
It would all be developed by legislative rule.
Oh, I see. And I guess one of the things I was wondering is, at least I think at WVU, most of the mental health fields are in the School of Arts and Sciences, not in health sciences. And I don't know what it would be like in places, other places like Marshall, like Concord, that also may also train social workers and mental health counselors. Do we need to say something about that, or do you think that can all be developed through rule?
I think it can be developed through rule, but I also think these are two different programs. So one's going to be a scholarship program, and the other's a loan repayment program.
Do we have a loan repayment program for health? Well, that's what the grant is for, right? On page 1?
No, that's just some of the money that can be used. That's the money that is actually used for the HRSA.
The loan repayments?
Yes. That's used for the scholarship program. At least that's my understanding.
But it does say,
It does say loan repayment, yeah.
Yeah.
So maybe I'm
And
wrong on that.
did anybody consider spelling out what occupations are a mental health provider? Or, usually we would do that.
That would be up to the discretion of the sponsors.
Oh, and is it the Higher Education Policy Commission that's going to promulgate the rule?
That's correct.
Okay, so they would have supervision over all
Yes.
of higher education. And they could spell out what mental health providers could be eligible for this.
That's correct.
And how it would work, but only if it's funded.
But only if it's funded.
Okay, I think I understand, thank you. And I want to thank the sponsor, I think this is a good idea.
Doug Wilson.
Thank you, Mr. Chairman. Council, I want to go back to the funding. If I'm reading this correctly, I'd like to ask you to help me make sure that I'm tracking this. The funding for this, if I understand correctly, would come from general fund through HEPC?
It would come from an appropriation from the legislature.
Right, so from the general fund. All right, thank you. Thank you, Mr. Chairman.
Further questions, council? Doug Rowan.
Is there anyone here from DHHR that could clarify if we have,
There
already
is.
have the program?
Yeah. All right, by leave of the committee. Yeah. Can you state your name and title, sir? If it's on.
We got to turn it on. I'm Bruce Adkins. I'm the Director of the Office of Community Health Systems and Health Promotion for the Bureau for Public Health, DHHR.
Okay, Ms. Atkins, we have to have you sworn in, so if you raise your right hand and repeat after me. Swear to tell the truth, whole truth, nothing but the help.
I do.
Okay.
Does the state already have an existing program that handles this?
The state, and through the federal government, through HRSA, does have a state loan repayment program currently.
Okay, and there is a grant then, do I understand correctly, there is a grant from HRSA that will cover this?
Delegate, I want to make sure I'm going to answer your question. You mean cover the program in the bill that we're discussing?
Yes, sir.
I don't believe that's the intent that the funding that's coming to the state loan repayment program that is state funds plus federally matched. I don't believe it's the intent of that to be covering that funding. It would, I believe, come from separate funding.
Okay, thank you very much. Thank you, Chairman.
Further questions, Mr. Atkins? Doug Fleischauer.
Thank you, Mr. Chairman. Could you tell us a little bit more about those HRSA grants and how much are they and how the funding works?
Sure. You asked earlier, Delegate, about the amount of state funding currently being matched, currently going in. It's $135,000 for current year. So that is matched one-to-one by HRSA. So I believe that answers your question.
Could you remind us what HRSA is? I forget. I know I should know, but I'm blanking.
I'm sorry. It's the Health, I even wrote it down so I remember how to say it. Health Resources Services Administration, long-standing federal agency.
Right. And it's under the Department of Health and Human Services in the federal government?
Yes.
Okay. And so how many, and it is a loan repayment, not a scholarship, or which is it?
Is a loan repayment program, yes.
So you said $135,000?
And then it's matched within the...
$270,000 a year?
Yes.
So how much does that fund? I mean, how is it distributed? Does it help 10 people? Does it help 5?
We're required through the grant agreement to fund at minimum 8 qualified health providers. Many times we can do more than that.
You mean,
Just depends on the applications. It's all done on a yearly application process.
And so how much do the recipients typically get?
They can get between, anywhere between $10,000 and $40,000 depending on their level of practice. And it varies from application to application. They literally can ask for an amount, but no more than that.
So 40 is the max per year?
Yes.
Per person?
Yes.
And do you use all the money every year?
Yes, absolutely.
Good.
We typically have many more applications than we do funding.
And do you have a criteria for figuring out which ones to choose? Can you
Yes.
share a little bit about that?
There is a set criteria that HRSA actually sets. There's a little bit of leeway that we can set specific criteria. One of the things that you will be interested in that I definitely want to share is that HRSA has set, because of the opioid crisis around the country, they have set a premium criteria for mental health.
Oh, but you can only use this funding for those limited, like clinical psychology, doctoral programs, and clinical independent social workers. You're limited by the part of the code that says the degrees and certifications that are eligible?
The state loan repayment program is wider than just mental health. It can go to a broad criteria of clinicians. I'm happy to read it to you if you want to hear it.
Well, I guess I'm wondering a little bit, those are, it looks to me, if this is the complete list, it includes medical students in A, and emergency medicine internship and primary care, and then it lists in B on page 2, nurse practitioner, nurse educator, nurse midwife, physician assistant, dentist, pharmacist, physical therapist, clinical, doctoral, psychologist, licensed independent social worker, and other disciplines identified as shortage fields. So have we done that? Have we identified shortage fields that might include some of these mental health care providers?
The answer is yes. Let me make sure you were reading directly from the bill, correctly?
I'm reading from the code.
Oh, from the code. I'm sorry.
Well, it is in the bill.
Okay.
The current code that's in, do you have a copy of the bill?
Yes, I do.
Okay. So I assume that's what is in the HRSA program, are these different professions?
There are additional programs within the state loan repayment program in addition to the ones mentioned in the bill from state code. Those include pediatric, geriatric, psychiatric physicians, family, internal medicine physicians, obstetrics, gynecologists, psychiatrists are in there separately as well, but also the eligible disciplines include nurse practitioners specializing in adult, family, pediatrics, psychiatry, mental health, geriatrics, those specializing in dementia, women's health, certified nurse midwives, physician assistants specializing in adult, family, pediatrics, psychiatry, geriatrics, dementia, women's health, dental professionals, general pediatric, registered dental hygienists, and then, of course, the mental health professionals are identified by HRSA and the state loan repayment as health service psychologists, licensed clinical social workers, psychiatric nurse specialists, licensed professional counselors, and marriage and family therapists. Some registered nurses with specialized training qualify. Pharmacists also qualify.
So where is this list of all the professionals that are eligible for the HRSA grant? Where do you have that list, or is it published when you announce the loan repayment can be applied for?
I have a fact sheet directly about the state loan repayment program that's a public document. Happy to leave that, share that with you.
Yeah, maybe share it with council.
Sure.
So one of the things I'm wondering is what mental health providers, because the purpose of this bill is to make sure mental health providers have some assistance. With the crisis that we're experiencing right now, we want to make sure they have some opportunity to get help with loan repayment. What mental health providers, if you can answer this question, would be left out of the ones that are included from HRSA?
I believe, and again, from looking at HRSA's documentation, I believe they have most of the health providers from, the medical, MD, DOs, psychiatric physicians, down to the counselor level. I believe they have them all covered.
Because they have licensed professional social workers and they have licensed professional counselors in the list that you have.
Yes.
So that was broadened from what we originally had in the code, because there is a sort of catch-all in any other high-need areas. Okay, thank you very much.
Thank you.
Maybe others have questions.
Questions of Mr. Atkins? Delegate Atkins?
Thank you, Mr. Chairman. One question, sir. Do you have any restrictions on whether these people remain, how long do they have to remain in West Virginia, and what part of, if any, of West Virginia do they have to serve?
The requirement is a 2-year commitment as of what I spoke about. If we give them a certain level of loan repayment, they have a 2-year commitment. If there's a smaller amount, say a $10,000 amount, that commitment would be for 1 year.
I'll catch back. Thank you, sir.
Yes, sir.
Any further questions, Mr. Atkins? Thank you, sir. Any further questions, council? Delegate Fleischauer?
Question the sponsor.
Sponsor yield?
I was just wondering, were you hoping to what was the need that made you think this, or that provoked you to introduce the bill?
Okay, during interims, during this past year, we, in health interims, we had people from DHHR and from education come in, and I think it was in May, we asked them to come back with a report for us. And that report somewhat came back, I guess, and Christine Mullins from DHHR submitted a report 1210 stating that we are 1,507 professionals short if we were to deal with the opioid problem or drug problem in our schools, the emotional problems, behavioral problems in our schools. And my thoughts on this is, how do we get more people into this field? And I did talk with council. We drafted this bill in this fashion. And also, we're trying to keep people in West Virginia. You know, we talk about the drain of people leaving West Virginia. So in this bill, we stipulated 5 years in a rural area and a needed area of West Virginia. And usually if someone stays 5 years, we have a chance of keeping them in our state. So those are some of the reasons, and there's a real need. I mean, I asked the question, we have the ACES program, and through interims we were identified, everyone got up, teachers can identify the problem, DHHR can identify the problem, who's going to take care of the problem? Yeah, I asked that question, I think, for some of you who were there, every meeting I asked the same question. So that being said, this is just a small thing to do to try to bring about more people in the behavioral mental health field staying in West Virginia and serving the needs of rural West Virginia, whether it's in our health department or in our school system. There's a big need. Thank you.
Thank you very much, Delegate. Council, could we have the, was it Mr. Mullins, the gentleman from Health Promotion that does this program that was just up here?
That was Mr. Atkins.
Atkins? Could we have, it's confusing with Atkins and Atkinson. And maybe Jeremiah also, because I was going to ask a financial question. My question is, if we, no, you too.
Mr. Atkins, stay up for a second.
If we put more than $135,000 in, would we be able to give out more money to mental health providers if we put more into this account, more state money?
I mean, the answer is yes. We could. We're trying to prioritize funding that goes to all levels of mental health providers for the very reason, the opioid crisis. So the answer would be yes, we could.
Do you know how much money we might be able to get if we put more money in?
500,000 is what's...
So we could have $1 million for scholarship if we increase the amount of this line item. It wouldn't necessarily all go to mental health providers, because it would also go to physicians and nurses.
The answer is yes. I mean, I would caution at this point in time that we may not be able to, at this point, get the match from HRSA. We're in the first year of a 4-year agreement, and we may be able to appeal to them to see if they would give us more match. But we actually asked the question yesterday. We don't have a response back yet.
Okay. Jeremiah, would you be willing to answer to some questions?
Jeremiah, consider yourself under oath.
Jeremiah Samples, Deputy Secretary, DHHR.
I'm just trying to figure out if we need a new account for mental health professionals, or if we can add money to, and is this a line item, this HRSA grant? Or is it something that just comes out of the DHHR budget? And maybe that's a hard question, you don't know the answer to.
My understanding, Delegate, is that this funding comes from our primary care line item, which also funds school-based mental health and serves as a unfunded, or funding for the uninsured for FQHCs. It's in that same line item.
It's a big multi. So
But I believe it's about $3.5 million or somewhere in that ballpark total.
Well, I'm just trying to figure out if we want to address the needs that have been identified by the gentleman. Would it help to add money to this state loan repayment program, or would that be such a big line item that it would just get lost in there? And would it be better to have something separate?
Honestly, Delegate, on the spot, I don't know if I
Sounds
have
like a
an
hard
adequate response to that. I think the point that Delegate Atkinson continues to bring up about the shortages of behavioral health specialists, especially folks that can help in the school system, is one that we are also very concerned about, and work closely with him to try to figure out ways to make this happen. At some point, there is going to have to be, and at least in my opinion, an investment if we are going to see that policy through, and this could be one strategy to do that, but that would be at the policy discretion of the legislature.
Well, my concern, and I don't know if this is a question, is figuring out the way to, what words to use so that that actually happens. And so perhaps we can give it a little bit more thought and see if it needs to be tweaked either here or in finance. You don't have any suggestions?
I would prefer to discuss with my colleagues before I would.
Okay, well then that is the question. If you might want to get back to us about the best way to provide greater assistance to mental health counselors, and so that they would stay in West Virginia and work in the field in education and elsewhere. Thank you very much.
Yes, ma'am.
Delegate Atkins.
Thank you, Mr. Chairman. This may be more of a comment, but we're talking $280,000 here with the and possibility of getting $500,000. That seems a small price to pay in prevention, and that's what we're looking for here versus rehabilitation. Achievement versus disruption at our schools and in society, and drug-free versus drug dependence. I would I would be willing to work with you in any way we can to get that up to $500,000, but that's still not very much money concerning the problem that we have here in West Virginia at this time. Thank you very much.
Delegate Thompson, do you have a question of either of the gentlemen? No? Any further questions for Mr. Atkins or Deputy Secretary? Thank you, gentlemen. Any further questions, council? None? Any amendments to the bill? No amendments? Chair recognizes Delegate Hill.
Thank you, Mr. Chairman. I move that HB 2674 be reported to the floor with a recommendation that it do pass, but that it first be referred to the Committee on Finance.
Delegate Hill moves that House Bill 2674 be reported to the floor. Recommendation do pass, but it first be referred to the Committee on Finance. Is there any discussion on the bill? Delegate Pushkin.
Thank you, Mr. Chairman. I appreciate the sponsor of this bill, seeing this need in our interim committees, which is what they're for, and taking a proactive measure to address it and trying to find a solution. I strongly support this bill.
Anyone else wishing to speak to the bill or sponsor? No. Before us is Delegate Hill's motion. All in favor, say aye. Aye. Those opposed, nay. Ayes appear to have it. Ayes do have it. Motion adopted. Would Deputy Secretary Samples return back to the podium for a second? Secretary Samples, there was a question on one of our previous bills that Delegate Fleischauer had. I'd like to give her the opportunity to ask that question. It had to do with the nursing homes reporting financial information, and that was taken out of the bill that we had. She may ask you more specifically.
Yeah, the bill, which is 2607, it relates to licensing of nursing home. There was some language taken out of the bill because they are now exempt from reporting under the Healthcare Cost Review Commission. They don't have to report to them. And so there was language reflecting that change had been made, but also stricken from the bill was language about them reporting on a yearly basis about their operating costs and their assets and stuff like that. And my question was just, do they report to DHHR and or to Medicaid in some fashion what their finances are? And the reason I was asking, obviously, nursing homes are a big part of our Medicaid budget. A lot of our state funding of our whole budget goes to end-of-life care. And I assume we have some check to make sure that these are financially viable entities.
Yes, Delegate. It's my understanding that through the reimbursement process where we reset the rates for nursing homes, that information is shared with our finance unit and with the department. And so we, in essence, collect it twice today, and this would eliminate one of the reporting avenues for that.
But as far as you know, it is being collected.
It is being collected, and staff are affirming that from the audience.
But it's not going to OFLAC. Is it going to Medicaid?
It goes to our, so within DHHR Finance, we have a unit that is specifically tasked with setting rates on an annual basis for a number of different provider groups. They primarily do this for Medicaid, but for other units as well. And through that process, the nursing homes submit their financial information to this unit so that we can, it's a cost-based reimbursement type formula, so we can reset those rates for the next year. Sometimes the rates go up, sometimes they go down, but we do receive that information in DHHR Finance today.
Okay, thank you. That was what I wanted to just ensure. And thank you, Mr. Chairman.
Any further questions? Secretary Samples always here. All right, thank you, sir. Any further business before the committee? All right, Chair recognizes Vice Chair for a motion.
Thank you, Mr. Chairman. I move to adjourn.
Delegate Hill moves that we adjourn. All those in favor say aye. Aye. Those opposed, nay. Ayes have it.